So today, got it. Thank you for joining us this morning for our 8th HFNY Accreditation 101. This morning, we're going to be focusing on the best practice standards for governance and administration, so the GAs. So here's the agenda for today. Actually, I should just mention we are recording. You heard us chatting about that. So like the other 101s, we'll be taking the PowerPoint, the recording, and uploading that to the website. So that way you're able to view these later on and go back and take a look. We will have time for questions at the end, but if things come up and you're afraid you're going to forget, please feel free to put your questions in the chat. So we'll circle back to those later on in the presentation. So on the agenda for today, we're going to take a quick look at the accreditation timeline. Like with everything, right? There's some updates that we made based on some of the changes we had to policy release dates. We fell a little bit behind, so we had to move things around with our timeline. So we'll just take a quick look at that. We're gonna, like I said, review the BPSs for the governance and administration and look at what's needed for your self-study. In addition to that, we're going to review the updated internal quality assurance calendar. So Karina is going to walk us through that calendar that's been updated, the colorful chart that you've probably seen before. So that has some updates to align with the new standards. We're going to take a look at a sample continuous quality improvement plan in the MIS. Because that is also part of the GAs, is being able to submit your plan. So we'll take a look at one of those. We're going to also walk through some updated stuff in the MIS that will focus on the new requirements related to reporting child abuse and neglect. So as I mentioned, we're definitely going to have time for questions at the end, but like I said, feel free to put your questions in the chat as they come up and we'll circle back to those. So just a quick look at our timeline. We're moving along. We are obviously in September already. So today's 101 will focus on GAs. But again, diving in a little bit more with the child welfare reporting and documentation, because there's some new requirements and tracking and follow through that is required. So we'll spend some time taking a look at that. And we have switched things around a little bit. So initially our plan was to review best practice standards 7. However, we've had to move that to October as we're still trying to work on finalizing, looking at your comments and finalizing those GAs, and then being able to send out the 7s to you for feedback. So we're going to focus on the 7s in October, as well as look at the performance indicators, just kind of review some of the information in October related to performance indicators. November continues to be determined based on what the needs are. Putting in your final stuff in December, final data entry, getting your things all set. If there's any updates or anything needed for the self-study, working with your program contract manager and CA partners to update anything that might need to be looked at or updated for your self-study. And then those self-studies are due by January 5th for all. So those aren't changes, just the focus on the standard 7 really is the change for our timeline. Okay, so the first set of GAs, so that's looking at GA 1A through GA 1C. All of these self-study requirements can be found in your annual service review. So when you complete your annual service review, the narratives are in there. And so that, when you submit your ASR, these items should be covered. Take a look at those. They should be covered in there as part of your self-study. And so the first one really has to do with describing that community advisory board, their role and advising with regards to planning and implementation and the evaluation of your site activities. And then for GA1B, those advisory members, so the roster from your advisory board, with some detailed information around their organization, their summary of skills, knowledge, abilities to effectively serve the interest of the community. And so if you haven't already, pulling those things together as you prepare for your ASR, making sure that you have that completed information in there, because again, that's what you will use as your narrative for the self-study. And again, for all 43 programs that will be submitting a self-study, you can just upload your ASR. You don't have to break things out. Just making sure that you are addressing each of the areas based on that template that we have provided for you. And then for GA1C, this is, you know, that narrative describing how you as the program manager, how you're partnering with your advisory board to be able to provide them information during each of those meetings, how you're engaging with them to ensure that they're advising those site operations. And so again, these are components of your ASR. So take a look at the template so that you're addressing each one of these. And then when you submit it, you should be all set. So that's why the check marks are there. These are things that you are already working on or should be working on. And so it's not something separate that you need to do for the self-study. So the next is GA2A, your quality assurance plan. So your self-study requires you to submit a quality assurance plan. So if you are submitting policy GA2A, which you should be doing, you'll also want to include the quality assurance activity calendar. That is part of that reference table in the policy. So you'll want to upload that into your self-study as well. And those two things combined will be your quality assurance plan. You're able to show in the actual policy how we lay out quality assurance for HFNY, and then really specific with the calendar of activities that you do to support your quality assurance. And then the second part of that is that quality improvement plan, or the CQI plan. And so this for all sites except for McV will be found in the MIS. And so that's that CQI tab on the MIS that you should be filling out based on what you have identified as your CQI for the year. And so what you can do is just print out that screen in the MIS and upload that into the SharePoint for that quality improvement plan, and that'll act as the document for that. They'll be able to see that completed in the MIS. For McV programs, we know that you're using the COIN platform to be able to show your CQI project for McV. So you can use that. You don't need to create something separate. That document that you're using in the COIN platform, you can upload that into the SharePoint. So again, there's no need to re-enter your CQI plan into the MIS. You know, go ahead and use what it is that you're working on. So then let's take a look at the updated internal quality assurance calendar and that sample CQI plan. So I'll turn it over to Corinne so she can share.
Okay, so thank you, Allison. So basically, I wanted to share what that QA activity calendar looks like. As Allison said, it's going to be part of the it's going to be included in the reference table. The final version is the one that I have right now. I have to make the correct link in the on the policy, but we need to finalize it. Basically, these are all tasks that you are already completing, that you are already doing. we've organized them under different domains that HFA wanted the QA activities to be under. So you can see that, and you know, based on what the old QA calendar looked like, we modified it so that now you still have the 3 months, so it is worth a quarter. But then the weeks have been organized under the different domains. So you have week 1, you would every month, you would take a chance of looking at how that initial engagement is going along, how it is. So it's not something that you need to do every month the same thing. You have different tasks that cover what you are already doing anyway. So you do things like reviewing capacity building, or making sure that that initial contact that staff is sharing with families, those phone calls that they're doing when they are contacting families, that message is what you are all you know, set on what it is that you want to let families know about Healthy Families New York. So the second week is more about home visit. So you would have all the tasks list here about things that you are already doing, but they're separated in months. This is up to you how you do it, but this is the way that we've organized it so that we make sure that all the tasks are there. On week 3, we focus on supervision, and week 4 is management. So other things that you might want to pay attention to, like, for example, you know, making sure that staff gets the surveys. This is done once per year, but I put it in here so that you remember that one of the quarters you have to take care of this. That is not the same with reviewing caseloads and case weights, where we're recommending that you do this monthly. So if you notice, we have it in month 1, we have it again in month 2, and again in month 3. And so team meetings, the same, you know, like that usually has to happen once per month. So you're going to see that team meetings, you know, are every single month. But so you have all the different tasks separated by the domains. And on the second page, you have the reports and other suggested resources to complete the tasks indicated above. So let's say that you want to, and I'm sorry if I'm getting anyone dizzy, let's say that you are in week 2 and you of month 1, and so you want to look at service referral follow-ups, review case notes and pre-enrollment activities, reviewing FGPs, fatherhood involvement. Where do I find how to do that? You would have in that same box which reports are recommended that you run, so that you can make sure that you are overseeing these things that need to happen. And this is pretty much it. So you're going to see that before, in the last calendar that we had, we only included MIS reports. This time around, I included things like review the one-step toolkit with staff. So you remember that month 1 was that messaging that we're saying, what are you saying to families when you make contact? So a good resource would be to make sure that you're reviewing with staff that one-step toolkit that has, you know, the messaging, how to overcome the no's, how to, you know, start a conversation, start that that relationship. Then you have things like check the TOL for team building activities, so that you can, you know, make sure that you have ways when you are conducting those team meetings that you do something fun. There's tons of resources there, so you can take a look at those. And we've also, like, have, of course, tons of reports here, but a lot of, like, making sure that you review the Cheers handbook or the Frog toolkit. And there's, in each of these, a suggestion of looking for trends in the MIS data so that you can discuss at those team meetings. Here, the review the PI results, I put twice annually. This will not happen every quarter, but it will happen twice a month that you will be doing that. So let me know what you think about this. As Alison said, it will go into GA together with the policy. It will be, the link will be on the HFNY website. Play around with it. If you think that this is a good idea and you need it, I always share an electronic version with you guys, so I could share the spreadsheet so that you can cut and paste into your own calendar, because some people have said that that is one way that you make the most use of it. And then also because you can split up the tasks among your supervisors so that so not everything is on you. You can say, okay, you'll be in charge of doing these tasks, and they can grab and put it into their own calendars. Any questions? Okay, so Alison mentioned that you look at the data using this calendar, you take a look at this and you run reports and you see the trends coming, and you see that, okay, we could work on XYZ to come up with a CQI project and, work on that. So, first recommendation is to watch all the different webinars that OCFS has shared this past year, and then to use the MIS to keep that. You have, I'm going to share again my screen. So I'm on the test site here. You do know that to find the CQI form on the MIS, you would have to click under settings, and here you have the CQI plans. So when you click on it, you start a new CQI plan that you would put. Let me just do one thing. I have it. I want to move this here so that I can talk and do this. So everybody's seeing my CQI plan on the screen, correct? Okay, so here you follow pretty much the different instructions that you have, and we are going to share a copy of this, Alison, correct? We will be sharing a copy of what a basic plan looks like.
Yep.
And how to follow it. But you would put the name, the start date, the anticipated achievement date, what the plan status is. So you would mark it as active. You would select the plan area of what it is that you are working on. So you get to choose what it is that you are going to be doing. And then you have, instructions to how to start it off. So for example, the one that I created so that you can look at is improve program performance on FGP. So the baseline would be, okay, we ran the MIS 6-2 and we found that we're only 47% of families had an active FGP. So we met at a team meeting and realized that not all staff are aware of the requirements of what the policy says and the BPSs. So what do we do about that? We decide that that is going to be our plan. Who is going to be monitoring? Supervisors will work with staff to implement the change, and the PM is going to be the one who's monitoring. What is your aim? And so you start answering all these questions. Now, the minute you start typing anything in, the instructions disappear, but don't fret. You have them up here under the little question mark. So you can type, and if you can't remember exactly what it is that you were supposed to be putting, you have everything there under the question mark. So you have to decide, okay, what will your strategies be? So once you submit your plan, then you would get the chance of adding your strategies. And for that, we just put something and see if I can submit this. No, I can't. Okay, I don't want to be having to do all of this. I'm sorry about that. So basically, once you do, and I don't have any one, do I have one? Let me just go for a second. Yes, okay. So here you would get to, in the do section of the plan, once you've submitted that first one that I showed you, you would have the possibility of adding your strategies. So you would go in with adding your strategy. Number one, what will you do? Staff will complete the training. And when is it that it started? How frequent you're going to be checking in on it? What is the anticipated achievement date? So you go filling out the different possibilities that it gives you. It's very straightforward. So you go putting in, you put the frequency again, what's the anticipated, who will benefit, and so you start saving those different strategies. Thank you. And then you go back every time that you said, if you said that you were going to check weekly, you go back weekly. If you say monthly, then you go back monthly and you check in and you see, okay, how did we do? So you write what it is that happened, what are your next steps, and every time, go back and take a look. If it was, you select which one you're going to be doing and you say what you are. You also have the possibility of adding supporting documents to the plan. So for example, I started off with putting the FGP training guide so that everybody has access to it. What are the questions? But you can add any kind of files from your computer very easily, and you can do that. So what does it come out, or does it end up looking? Because you can save and print every single one of them. And so you finally have, this is what it would look like. So it says which program it is, what's the CQI plan's name, the start date, anticipated, and you have everything in a 2-pager, basically. You have all the strategies, like what was decided, the check-ins that were done. So every time that you check in, you would have to write down what happened. And so you would have that all the way until your anticipated achievement date, which was in, or is in, December of this year. And you have there what it is that you added. So everything is in a 2-pager, that this is what you would be uploading to your self-study. Any questions? There are some people that I've seen that already have been working on this. We've done trainings on how to do this form, so this is nothing new either. But we have noticed that there are some programs that still appear to have a 0 in their CQI project. So that's why we wanted to remind everybody we do have tons of resources available for you. If you still struggle, reach out to me and I can help. And that's it. Thank you. Oh, that's great to hear, Esther.
Is there other stuff in the chat? Oh, okay. Perfect. Great. Okay, so moving on. Oops. So for family rights and confidentiality, a couple things I did want to mention. So the first one is that checkbox, that policy will be coming as final. We're just working on taking a look at comments and feedback, and then we'll finalize that and get that out to you. So that policy has all of those elements that is needed for the policy. And so it's just inserting your specific procedures and having those reviewed by your program contract manager and then approved as final. And then that is ready to go in with your policy manual. Although the next one for GA3B is not a self-study item, it's something that's going to be reviewed on site. Again, I know we talked about this 2 times ago. It is an essential standard, so the family rights and confidentiality form. And so I did want to remind folks again that HFNY now has a specific service agreement and family rights and confidentiality form that's required to be used by all programs. And so as of April 20th, we were asking programs to start with those newly enrolled families to start using that. And then for existing families, programs would need to have those enrolled families sign an updated form to replace the current one that you have on file. And that was to be done by August 14th. So I did want to remind folks that at this point, all enrolled families in your program should have the updated service agreement and rights and confidentiality from HFNY signed. Also that, and it says right here on the slide, but programs can download those documents from the MIS. We have them available in 5 different languages. I think it's 5 or 6 different languages that you should be able to download and use with the families that you serve. So again, it's an essential standard, making sure that that form has all the required information from HFA. So making sure that you are now using the required forms for that. Again, not a self-study item, but something I wanted to remind folks about, just to clear up any potential confusion with the service agreement and rights and confidentiality and informed consent, because the informed consent is a safety standard. So although it's not in the self-study, it is something that is going to be reviewed on site if your site is selected. And so programs are required to get family consent. This is separate from the service agreement and family rights and confidentiality form. So the informed consent is whenever you're going to be exchanging family specific information with another entity or service provider or anyone, doctor's office. Just because you have a service agreement and family rights and confidentiality does not mean you have permission to exchange information with other providers or other entities. You have to have a consent form. And so that consent form must include a signature from the person who the information about is going to be released. So parent, should sign those, the family should sign them, depending on who it is that you're collecting that information from, their signature should be on it. Or if it's for the target child, having that parent sign the release on behalf of the minor child. The specific information to be released. So consent forms cannot just be open-ended and just say all medical records. Like, it really needs to be specific, and that's something that is directly in the best practice standard. So when you are having staff, work with families to complete that, you want to be specific about what information it is that you're gathering, what the purpose is that you're going to be using the information for, the specific date that the release takes effect. And then there needs to be a time frame or a date the release expires, and that cannot exceed 12 months. So you can have it shorter than the 12 months if needed, but it can't exceed the 12 months from the time that they sign it. And then the name of the person or agency to whom the information is being released to, and the name of the Healthy Families New York program providing the confidential information. And then also that a statement that the release that the person may withdraw their authorization at any time. So those are the must-haves on that consent form. Again, it's separate from the service agreement, rights and confidentiality form. It is very specific and individual to each of the families and each of the entities that you're looking to exchange information. And for those that are doing child welfare protocol, I know we've talked about this, it's in the MOA, that memorandum of agreement, but even with child welfare protocol referrals, that does not give permission to just openly release information. You still have to get consent forms from the parent to exchange information with anyone, including child welfare or child protective. Okay, so I did want to mention that just to clear up any confusion. And then I did just pop in here the sample consent form that HFA has available on the community network resources. Honestly, like I don't love this form, but it is their form. You can create your own, but you want to make sure or use your agency specific consent form. A lot of times agencies have their own consent forms that you're required to use. You just really need to make sure, that you're comparing that to the best practice standards and to our policy to ensure that you have all of those required elements. So they all have to be there in order to be in adherence to the standard. Okay, so the next is GA3E. So this is participant privacy and voluntary choice in research. And so for this one, the self-study requires you to submit a narrative indicating whether or not your site is currently or was previously involved in a research project or study within the past 5 years. We do have a specific policy for our policy and process and procedures related to research studies I'm sorry. And the requirements that we have when requesting to participate in a research project or study. And so you would refer to GA7D, which those will be released soon. I don't think that there's much update to that specific policy from the last time because our requirements are essentially the same. So you'll want to refer to GA7D anytime that you're interested in participating in any sort of research project or study. And thanks to Claudia Miranda Julian for providing you all with some boilerplate language that you can use when you're submitting this specific documentation for your self-study. And so we'll take a look at that in a second. Again, this standard specifically requests that you submit just something brief indicating whether or not you're involved or were involved in the last 5 years. And so, as I said, Claudia had written up some boilerplate language that you can use with a chart in here to describe, that, any research studies that you are involved in. And then there is an option here that the program did not participate in research. And so if that was the case, you'll mark off for all of those years that you did not participate. And so we'll be sending this out along with the PowerPoint. We'll also make sure we post it with the slides so that it's available on the website with the recording and the slides. But again, we'll make sure we send out the specific document so that you have that, can fill it out. Again, that's something that is easy to do and can be uploaded into the SharePoint for this particular standard.
Allison, I see in the comments, Olivia asked if this includes community surveys. Are you talking about surveys like might just come from some community partner or something like that? Or are you talking about family surveys that you would do within your program?
I'm talking about like specifically our public health department is coming up with a survey for program participants and is asking that we help deliver them to families, asking about dental hygiene practices. So it's their survey, but it's not like around HFA stuff.
So typically what you would want to do with something like that is you would want to reach out to your OCFS contract manager so that we can sort of make sure that it's not true research and that it's more about program improvement or quality improvement kinds of activities. So typically anything like the Department of Health would be doing would be around like needs assessment or, or program improvement. But we always want to make sure just to double check and to make sure that folks aren't using your programs and families in the programs as sort of a sample of convenience, right? Just because we already have these connections, right? We want to make sure that people are asking our families to participate in some of this, these different activities, because the information can be, representative or helpful and not just because they're here, right? So certainly reach out to your OCFS contract manager if you're not sure, but typically if it's about program improvement, continuous quality improvement, most of those are not considered research. That being said, you would want to make sure that if there is some kind of survey that's happening that your program is signing on to say, yep, we are going to partner with you, right, to administer this survey with all of our participants, that would definitely be something that you want to reach out to your contract manager, because that's where it starts to get a little bit more iffy. And then we also want to make sure that there are consent forms, right? So that participants know this is how my information is going to be used. These are the risks of participating, right? If that's necessary. And that's where that voluntary choice, right, for participation comes in. And we would want to make sure that both they have copies of that informed consent, and also that you're aware that they're participating. If it's just a general sort of, hey, you know, we're Department of Health, we're doing this survey, can you share it with somebody who might be interested, or make a poster, you know, in your office available? That's where it's a little less, you know, intensive, and we wouldn't want to worry as much about that. But just to be on the safe side, you would always want to run that by your OCFS contract manager. Does that help?
Yes, thank you.
Okay. There's a lot of blurring of the lines these days between research and evaluation that's designed to support program improvement, either at the state or county level, and that those internal sort of continuous quality improvement. And so whenever you're in doubt, reach out to your program contract manager. You know, if they're not sure, they'll reach out to us in BREPA.
Okay. So then we're going to move on to GA4A. So the policy for identifying child abuse and the criteria for identifying child abuse and neglect. And so this is a safety standard. It's been updated since the last BPS to include some new components and changes to practice. And so our policy includes the requirements. Oh, you know, we're working on that now. We'll be releasing that. So programs should make sure that you're reviewing really closely with staff the new policy and procedures, so that they're aware of their responsibilities when it comes to reporting suspected cases of child abuse and neglect. And so the new requirements include that sites have to have a mechanism to track and follow up on all children suspected of abuse and neglect, and that reporting all suspected cases of child abuse and neglect, including situations where it's believed a report has already been made by another individual or organization. And so we'll talk a little bit about, if you looked at the draft policy for this, for GA4A for reporting, you'll see in there that we have developed some mechanisms to be able to track those reports to the state central register. And so we'll talk about that. We're going to take a look at some of that stuff today. But just to give you a little bit more information. So what we're thinking is that during, like in the supervision portion of the MIS, that we would have a box in there to check if there's been an SCR called or a state central register called on a family. And then what staff and their supervisor should be doing is adding those risk factors or safety concerns that led to the call to the SCR. They would be adding that to the service plan. And that is going to be how we're following up on any of those concerns that arose either during the home visitor being present or hearing information that caused suspicion of abuse or neglect. And so again, we'll look at that in the MIS, but those were what we've put forth in the policy and what we're going to look at to be able to track and follow up on those reports. The second piece is really important around making reports of suspected cases of child abuse and neglect, even when you think that a report has already been made by someone else. And so this actually aligns with some of the practices, you know, that we have in New York in terms of, you know, if you're the person that's hearing that or seeing that, even if you think a report has been made, you should, to make sure that we do know that a report for fact that a report has been made. And so that's also been added to the policy. It's in the best practice standards as one of those new requirements as well. And so just wanting to be really clear with staff when we're releasing this so that they're aware of what their responsibilities are in terms of making those reports to the SCR. There continues to be the same requirements around, you know, having that criteria right in our policy to determine what is abuse and neglect. So those have been left in there. Those factors or indicators are in there, as well as the expectation that all staff, and I know we've battled with this phrase since, you know, it's been in the BPS, but acting in that mandated reporter role. And basically all that really means is that you're required to make a report to the state central register if you suspect abuse or neglect. So it just is like, so that's what we mean by mandated reporter. You're required to make that report. Even though New York State right now doesn't have home visitors specifically listed as one of the professions that are considered mandated reporters, we're saying through our policy, through the best practice standards, that you're required to do that. And then the notification of program manager or supervisor when abuse or neglect is suspected. And so that, again, that is something that's been in there and we've had conversations about. It doesn't mean that, you know, it's up to the program manager or supervisor to persuade the home visitor one way or another. If the home visitor feels like a report should be made, notification is really to just let the program manager and supervisor know that, and to have that opportunity to be able to support staff in making the call to the SCR. And so we're working on, like I said, updating that policy based on the feedback that we received from the field. But so that'll be coming soon as well, released as final, and you can work on your procedures for that. Okay, so then GA4C, again, this is the notification to the supervisor. So for this one, this the self-study requires you to submit a report of currently enrolled families where a child abuse and neglect was suspected and reported to the SCR or the proper authorities. And then documenting how the safety concerns are addressed and that appropriate follow through occurs. And so this is what I was talking about before, where we've created a new MIS report to help you track those families where a report was made to the SCR. So you're going to be able to print out that report to be able to show who it is that those calls were made. And then you'll also need to submit the service plan, because that'll be used as that mechanism to capture those risk and safety concerns and how you're following through. And so your self-study will include that MIS report. Any of the families that show up on there where that report was made, you're going to want to also submit that service plan as that second piece to show the documentation of how those risk factors are or safety concerns are being addressed, and that you're following through on those things.
Yeah.
Huh?
I'm sorry. I forgot I was on mute, but I was just going to ask, and maybe we'll just wait to the end for questions, because someone did ask about that, like if they should backtrack or if it's once the GA policy goes into effect. But we can wait for the questions.
Yeah, let's take a look at how, and then we can, at the end, if there's questions specific, we can dive into that. So where are you documenting suspected cases of child abuse and neglect? And so I will stop sharing and turn it over to Corrine, who will bring us to the MIS.
Okay. So basically, you're going to be discussing this at supervision, and when the case is discussed, you might have noticed, because this has gone up quite some weeks ago, that you now have a different, once you click CPS or ASC or ACS, I'm sorry, you have new boxes here. So basically, one is saying HFNY program. That means your program. Call the SCR, the hotline. So you would click, you would put the date that the SCR hotline call was made, and then you would discuss family involvement with CPS, if you know, like everything that you need. And there is indication there that you need to update your the service plan for the particular family. And with that being said, just a reminder that in this case, you would not be updating risk factors that happened at frog time, okay? You would be using the second piece of the service plan, the one that says additional, and you would put the home visit date and start the, you know, state all the risk factors and the plan that you come up with there. So this will end up being on a report that we published this past Friday that you might have seen in the news show up. So this report that's called GA4 Report of Suspected Abuse and Maltreatment Calls, you would have to run it, and you would have all of them there. I am now going to just open the documentation so that you see what we have on the on this report. So you have, as always, the start date, the supervisor, the worker will be listed, any sites, any program. The cohort will be all cases that meet the following criteria. The case has an intake date that is on or before the start date of the report. The case is either not discharged or was discharged after the start date of the report. The program has called SCR hotline about the case at some point prior to the start date of the report, and the call is recorded on the supervision form. So you need to put it on the supervision form. That's the first place, and that is how it's going to be picked up. So basically, you'll have the PCID, the intake date, the most recent service plan data entry date. So that is with the service plan that you've made changes to, that you've like updated and specified the plans. And you'll have the date of the SCR call, what the date in the supervision form was that you had it, who was the worker and who was the supervisor on that call. So you'll have everything listed in the report that will look something like, of course, we have nothing there, but will look something with data. It will look like this, okay? So you will have all of this information for you to print out and share if you've had to make those calls.
Thanks, Esther. I saw your question and we'll get to it. We're going to talk about critical incidents next, or coming soon. So was that all you had, Corrine? Just the report?
Yep.
Okay. Okay. Whoops. So then next we have policy around participant death and grief counseling. We refer to this as our critical incident report or policy. And so the self-study requires you to submit this policy. Again, these are the ones that'll be coming out soon, so that'll be in there. The self-study requires you to submit, it says, a narrative indicating any incidents of participant death that have occurred within the past year. So instead of providing that information like in a narrative form, you can submit those critical incident reports on any of the participant deaths. You'll want to make sure that those reports are updated to include any additional information on the incident and or the support that you've provided to the family. So specifically for this, it talks about, you know, making sure that you're offering those connections to grief counseling or mental health services for families. So you'll want to make sure, I know sometimes we do critical incidents and the report comes in and you don't have all the information. We are trying to circle back to have you complete any updated information that might be required based on questions that we have. So just take a look at any of those critical incident reports on participant deaths. I would say at this time, we won't ask you to submit anything outside of that because that's really what the best practice standards is focusing on, are the participant deaths. I know in HFNY, we have lots of critical incident reports on lots of different things outside of just a participant death. But for this specifically, if you've had a parent or the TC, that's what you're going to want to submit for the self-study or those critical incident reports, you know, surrounding that. I didn't put this in here, but Esther did ask a question about what about critical incidents. I just wanted to, and we should definitely, I think what we talked about in policy is eventually we have the slides in the presentation on child abuse and neglect reporting and specific to, you know, those requirements, but also having something for those critical incidents, because I think it has gotten a little bit messy and people are a little confused at, does one automatically result in the other one happening? And that's not always the case. So for critical incidents, it doesn't always mean that you're going to be calling the state central register just because you have a critical incident. If it's a death of a child, that would be different, right? If it's something where you know, there's no plausible explanation for that, you know, unsafe sleep situations, things like that, like we would always ask you to call the state central register for those things. But in situations where, you know, you're submitting a critical incident report because you know, the parent has passed away, if there's no suspicion of abuse or neglect towards the child, you're not going to be calling the SCR. So they don't necessarily always connect. They're really two separate things. Sometimes they both happen. Sometimes it's one or the other. And so we can work on trying to be a little bit more clear and maybe provide some more of that guidance in that type of presentation that we have for like the child abuse and neglect that's up on the website. We do need to update that to reflect the new policy. So we can certainly definitely provide some more guidance around those critical incident reports as well, and kind of teasing out some of those things. And sometimes it is just having to reach out and talk through, you know, what the next step should be. But in terms of the self-study, for this, we are asking for you to just submit any critical incident reports that you have where there's a participant death. So parent, caregiver, you know, anyone enrolled in the program, that you're submitting those critical incident reports and making sure that they're up to date, you know, have the information that you need before you're uploading those.
Allison, is it
Yes.
okay if I take a step back and ask a question about 4C that maybe is aligned with Olivia's question? I don't know if you were
Yeah.
ready.
Oh,
The
I-
backtracking.
I did not
Okay,
see that
so
yet.
Olivia asked, should we backtrack to document reports made into the MIS for 4C? And if so, what date? And just because the MIS report is so new, I would assume that it would say no, don't backtrack. But when you're submitting, for what's considered the self-study, which is, you know, all the documentation you're putting together. Maybe within that narrative, have that information since the report is so new. I don't know if, or do we want programs to go and start plugging in data for dates prior to the creation of the report?
No, I don't think so. I think my thought was that once the policy becomes in effect and we're ready to move, I don't think it's fair to ask people to backtrack and start updating service plans and trying to figure out things that happened. And I also feel like, you know, that they can, you know, start implementing as soon as that policy is final. If they have calls that are made, they would go in and enter the information from, you know, the start of that date. And if there aren't any by the time that you're submitting, that was a good question. If there aren't any, then that's what you're going to say. There aren't any reports at, you know, at this time that were being documented. For the sites that are visited, we will probably want to update that. Just thinking that as you get closer, if you're one of the 16 that are chosen, we're going to want to run that report again and be able to provide that information. But you also may run into a situation even then where there are no reports. And so that's okay. Like that's, you know, what we'll have to put as part of the self-study is that there are no reports to the SCR, you know, at this time. And again, worst case scenario, if we're considered like out of adherence, because technically, right, the standards went into effect last year, we could still get a 2 to show, you know, in policy that this is our practice now, and this is what we're doing now to make sure we're in adherence with that.
Hi, yeah, this is Melanie. This is what I had interrupted you, Allison. Sorry to ask about because I saw Olivia's question. And so to clarify, it will become effective once the GA policies go into effect.
Yeah, I don't think
That's
that
when-
we can
yeah.
make something without having a policy, without you knowing, without doing procedures, without notifying staff. Like we can't, right? And so, and then I don't think it's fair to ask you to go back and start backtracking stuff that you might not have all the information on.
Yeah, right. Thanks.
I do have a question though, because I know that you track that, right? In your let me see, let me pull up the accreditation thing. You track that in your QA site visit tool?
No, not the reports that, well, we don't really, we look at the policy, and right now, because the policy is not like in, you know, the updated one, we really haven't been able to look at the new requirements because we didn't have a policy or procedure. So we do look at their policy, we interview staff to make sure staff are aware of what the policies and procedures are, but we didn't have anything in place that aligns with the new standards yet until this policy comes out. So we aren't getting into that. We never have gotten into that detail about what are you doing to address it? What are you, it's really, it was around making sure that staff were aware that they're talking with their program managers and or supervisor. They're notifying them immediately, like those types of things. But this is new in terms of the tracking since the new standard. So that's not something we've ever done before.
Mm-hmm. Yeah, we didn't have clear, we weren't prescriptive in the, like, right, the policy that's current now until this one goes into effect. We were not prescriptive to give them direction on where to document that. And now this is what we're doing in this policy, so.
Anything else on that before we move on while we're chatting? Okay. Okay, so then for GA6, the policy and procedure manual. So the self-study requires you to submit the policy and procedure manual, including this specific policy that we created to show how, or to speak to how updates to policy and procedure are communicated to all staff in a timely basis, and that staff have access to a copy of the policy and procedure manual. And so again, this is coming. I know we did get some comments back on this one, just around some of the language. So we'll work on looking at those comments, updating it and getting it out as final. And then you'll be able to plug in your procedures related to this so that it speaks to, you know, how you are sharing that information with your staff and where they can find the policy and procedure manual. And just a note about the policy and procedure manual, I know we talked about it 2 times ago, but one of the tips that we had heard back from HFA, and I know it was something that some of the sites had experienced the last round of accreditation, where they had the HFNY policy as one document and then their procedures as another. We want to make sure that we're not doing that, because there were some programs that even, you know, in talking with HFA now, some sites that were out of adherence because their manual was separate. And so they were not counting the policy and procedure as one. And so if they were looking at the procedure and it was missing some of those key elements from HFA, those sites were not getting credit for both the policy and procedure. So we have our manual set up so that way you're inserting your procedures right into the HFNY policy, like right under it, so that it's one. And so that's the way that, you know, we want you to do that. That's the way we want you to submit the policies, to make sure that the policy and procedure like flow as one document, you know, one policy and procedure, and not have 2 separate places that, you know, you can find a policy and then a procedure, just to make sure everything is together and has all the requirements. Okay, sorry, my dog. So self-study submission, we've reviewed this a couple times, but your self-study consists of the following information that's going to be added to the SharePoint. So finalized policies and procedures, those that are approved by your PCM. If you update any of your procedures, you know, as you're kind of going through and getting ready for your submission, if you're feeling like, you know, you're reviewing, you're looking at documents, you're going to want to make sure that anytime you're changing anything, that you're sending that back to your program contract manager for them to review and approve as the final version that's being uploaded. Your annual service review and equity plan, so you're starting to work on those, you know, should be getting feedback from your program contract manager, sorry, as you're submitting those. So that way, we make sure that we're covering all of the items that we talked about that are covered in the ASR as part of the self-study and equity plan. Your quarterly reports for the last completed 4 quarters. So we have the dates there for those. Your MIS reports, so you can take a look at that accreditation tool. They have the report names for each of the self-study sections that require an MIS report, so you know what reports should be run. And then you'll want to, you can keep an eye on those now, and then also make sure, I know as you're going through the PIs and your quarterlies, like you're looking at that information, but just paying attention to that, because as you're getting closer to the submission date of January 5th, you'll want to make sure that you're running your most recent practice or catching anything that you need to in advance of submitting those MIS reports for your self-study. Your human resources info, I think this is something that was included in the 101 last time. So those standardized interview questions, job postings, staff resumes, development plans, if applicable. Again, using that accreditation tool to see the breakdown of the self-study submission by best practice standards and where to find the info. So for example, for each best practice standards, where you're going to be able to find that information that you already do. So like we talked about the ASR or your quarterly reports, MIS reports, it'll be in there to help you identify where it is that you're already capturing that information, or if there's something new that you need to do. So questions. I know we answered a couple.
Emily has a question. The quarterly reports we're submitting in the self-study, are those just the narratives or the narratives plus the data reports for those quarters?
The narratives and the data reports for those quarters. It's going to be both.
Nora also asked, if we have no incident reports involving participant death, is there a boilerplate narrative to express this? I said if it works for Allison and her team, we can certainly work on it.
Yeah, absolutely. I think the more that we can put for you to just plop in there, the better it is. So yeah, I think that would be great. So did I put the wrong date in there? So as a July contract, I wouldn't have my second quarter data entered yet, let alone the report completed by the 5th of January for the second quarter. Because the data is not due till the 10th and this is due on the 5th. I guess the thought was it's due to us on January 5th. So, but we have to hand that in. So we would want the most updated information. If there is a little bit of, like, we could give a little bit, maybe wiggle room for those July contracts. I just would want you to have the most updated information in there. And so, if maybe trying to work with staff, at least for that quarter, to try to get things in so that you can work on that quarterly report. Sometimes what programs do as well, like I've heard that they'll work on the quarterly report throughout the quarter, even if they're not submitting for the self-study, so that they're not doing it all at the end. I know some of the data stuff, obviously you can't necessarily put in, but some of the report you can work on in advance. So that way it's just kind of filling in those gaps. So for those July contracts, we can work on, if you're running behind in getting that second quarter report up by that January 5th, but I just think it's, we can work with you to try to get it in as quickly as possible. But I do think it's important to have, the most updated data going in there, because by the time we submit it to HFA, you're going to be like well into your, third quarter, or by the time, right, that they come here and look at your information. And so is there folders for everything? Yeah, so there should be. Claudia broke down the ASR, the quarterlies, personnel policies, and additional reports. We'll take a look, make sure we're not missing anything, but if you're feeling stuck on where you should upload things, if you could reach out to your cohort PCM about that, then we can make sure that if we are missing something, we get it in there if we've overlooked a folder that should be included. What else? I'll also mention that after the GAs go out as final, there are only one other set of policies that will go out for feedback and finalization. As we talked about, that'll be the 7s. So you should be wrapping up your policy manual within the next couple months, I'll say, because we are hoping to, release those GAs really soon, like within the next couple weeks. So you can start working on the procedures for those. And then next will be the 7. So I know it's close. It doesn't give you much wiggle room, but at least those will be done. So, just thinking about if there's anything during the 101s that we've talked about in terms of policy or procedure you want to circle back and look at. If you are doing any updates to anything, again, making sure that you're communicating with your program contract manager to look over those procedures and finalize any changes that you're making. But we are almost done with that policy manual. Okay, so then if there's any questions related to actually setting up your Outlook account so that you're able to utilize the SharePoint, you can reach out to Claudia. Her email is there. Any questions related to like interfacing or documents to upload or questions around the folders or anything like that, you can reach out to your Accreditation OCFS program contract manager. So that's the person in your little cohort groups to talk through any of those challenges that you're having with the actual SharePoint. And then lastly, of course, you can always reach out to any of us if you have any other questions or need support. We're always here to help you in any way that we can. So I'll hang on for a minute just in case anything else comes up.
I think it's safe to stop the recording, correct?
Yeah, I think so.
Okay, thank you, everybody.